So, prescription drug monitoring programs are a vital tool that we use in substance use disorder to monitor someone's use of medications, how often medications are being dispensed, and whether there's potential misuse. I would absolutely recommend that a clinician, physician, dentist use PDMPs. Of course, there's a chance, as with any tool, that it's not 100% perfect, though I think it has been helpful, and it's another tool to kind of bring into the room and bring to the patient if there's any discrepancy or anything that we're worried about. Often substance use and individuals who are afflicted with substance use really struggle to fully disclose substance use patterns because there's a lot of shame around misuse and what it might mean. So this is a way for us to open up a conversation of honesty with our patients, and again, to reduce any potential harm to our patients. If they are misusing prescriptions, it might provide evidence to us about what prescriptions we might use.
Well, when I use PDMPs, in the past, if you are prescribing a controlled substance to a patient, an alert will pop up and it will direct you to a patient might be at risk, or the history of their past prescriptions that might be in direct conflict with signs of drug abuse.
I think any health questionnaire is sort of an opening gambit. So everything has to be followed with communication. It's not just the checklist where you look at it and go, okay, you're fine, I have no worries about you. Everything has to have follow-up questions. I did this, and I strongly ask my residents in AEGD to make sure that you don't just look at the health history, you sit and you ask some questions. It doesn't take that long. And it's remarkable the things that you find out that the person either went, oh yeah, I forgot to mention that, or I didn't think that was important, or I can't remember the name of that blood pressure medicine, but it's yellow and it's round, and I take it every day.
Some of the questions I would ask about dental history would include, how was pain managed in the past? Have you had a tooth extracted? Have you had any acute dental pain? And how was this managed? Were you prescribed opioids? Did you have long-lasting pain that did not subside? And then even more so, what are your reservations about dental treatment? Those questions can provide a window to how we can proceed a lot better as clinicians. I think direct questions about opioid abuse and drug abuse are very necessary. We have a lot of questions that speak on current prescribed medications, about social histories. And the social histories tend to be tobacco use, alcohol use. I think there's still a taboo about asking patients about if there's any abuse in their past, whether it's opioids or cocaine or crack or heroin, because we don't want to offend the patient. But I think in order to have a better picture of who we are providing this treatment for, some of those questions need to be asked.